So, what's trending? Bridging your Catholic faith with your everyday life. You're listening to Trending with Timmerie on Relevant Radio.
It's great to be with you. Isn't it great that it is Friday here on Trending, wherever you may be, on the road, listening via the podcast, out for a run, wherever you may be. Wishing you a blessed Advent as we prepare in these last handful of days for the coming of Christ at Christmas. I know it's so easy to be distracted by the Christmas decorations, Christmas shopping. If you followed the wave of getting in ahead of time and making sure that you shopped early for Christmas because of some of the shortages and supply chain demand, well, perhaps you got the Christmas shopping out of the way. But you've been distracted because for so long we've been focused on supply chain, getting the right gift, having the right amount of time. So I want to encourage you as we're here in this Christmas season to remember these special days leading up to Advent that are so important for celebrating the great event of Christmas, the incarnation of Christ, the transformation of our lives because of the coming of Christ. That is, God become flesh. And so remember, we're in this third week of Advent, that third candle on the Advent wreath that tends to adorn our home and the altars of our churches represents joy. And so we should be standing in this joyful expectation, pondering the stories that lead up to the coming of Christ. And one area of particular joy I want to ponder for just a moment is the angels. The angels, one after another, who participate all throughout salvation history, but in particular in the coming of Christ. We know that the angels come to the Blessed Virgin Mary, Archangel Gabriel, to specifically come to her for her consent in bringing about Jesus Christ. That is, we referred to her earlier this week as cause of our joy, because her fiat, her yes, helped to usher in the coming of Christ. Of course, God could do it in other ways. He didn't have to have Our Lady. But this is the beauty of free will. Through our own acts, yours and mine, our own acts of free will, we too can participate in salvation history. In our salvation, salvation of others. Not that we save ourselves because God alone saves. But we can be fruitful soil, predisposed, willing to engage in the great mission He has set out for our lives if we choose to seek a path that will follow Him. And so this should be a great joy in this Advent season. And again, as we can become distracted from everything that has commercialized the season, in many ways for a great reason, because of how great the significance of Christ coming is, but at the same time, it sometimes leads us to lose sight. And so I hope you've been with us all week long as we ponder the joy of Christ coming at Christmas. You're listening to Trending with Timmerie here on Relevant Radio. Coming up, I'm going to be joined by Dr. Susan Caldwell. Dr. Susan Caldwell is a NaPro doctor who specializes in working with women surrounding women's health, fertility, infertility, postpartum depression, and overall women's health. We'll talk about a number of really fascinating things, especially talking about postpartum depression today and some of the benefits of progesterone for women in various stages in life. We're also going to dive into the topic of ADHD. I've heard so many of my peers over the years talk about their frustration surrounding being told that they were basically dumb or something was wrong with them. And after years of medicated education, they still found that there was no solution, that really wasn't the answer. And this is becoming to be an increasing trend, especially during COVID. There's been a rise in cases or diagnoses of ADHD. We'll talk about that and real solutions because it seems as if there's almost a war on boys in particular, but it's becoming a new trend, especially among teenagers, a higher number of teenagers being diagnosed with ADHD. Okay, I need to vent for just a moment though. So I was traveling cross country back and forth throughout the last couple of weeks, and I'm in the airport with my baby girl, right? And I need some crawl space for her to move around. She's been on a plane. We had a 5-hour layover. And as we're moving around, I find this open space. I'm like, great, look at this is a great area. You know, people are sitting, nice and relaxed. Well, I go to set her down on the floor, and all of a sudden she starts going, dog, dog. She's saying dog. I'm going, what? I'm looking around. Of course, I'm expecting there's a service dog. Well, there was a service dog. And the service dog was a pit bull. And I'm sitting here. I'm sorry, but just for a moment here we are in a enclosed, confined space, and someone has a pit bull for a service dog. Is it just me, or does this seem highly inappropriate? I am a little frustrated with some of these service animal approvals. Grant, I know nothing about this person, what they're struggling with. It was two college-age girls dressed very gothically who then also had a pit bull on a studded chain with them in the airport. That would be the only reason why they would be allowed to have it, because it would be some sort of service dog or, quote, emotional support dog. Now, don't get me wrong. That's great. Dogs can be incredible emotional support to people. But my issue was the safety in a crowded, confined airport. So I'm already kind of feeling a little anxious. I'm trying to find different areas for me to sit with a baby further away from the dog, because here is a much tinier little human being than this pit bull that's nearby. And this woman keeps moving with her pit bull to areas close that seem very uncomfortable. And, you know, the dog's not acting aggressive or anything. And I'm kind of just like, it's okay, it's fine. I know some people try to say pit bulls can be incredibly sweet. Sure, but that's not what they're normally bred to do. That's not normally their type of job, is to be as calm as some of these are behaving at this time. So next thing you know, another dog shows up, and all of a sudden the pit bull starts acting aggressive, starts jumping up, kind of pulling forward on its little short leash, because you have to have a super short leash apparently to be in the airport with the service dog. I'm thinking that is 2 seconds away from falling out of her hand if that pit bull pulls hard enough. Anyways, lo and behold, kind of my whole perspective was, what do you think about these service animals? At a certain point, are we being inconsiderate in safe environments where, for example, lots of people are, little kids are going to be sitting around? You know, at what point is it too much? And I think that this brings me to my overall topic of today, as we're talking about everything from postpartum depression to even the issues surrounding ADHD, that we're looking sometimes for solutions that aren't really true solutions. And I think that this whole getting to the point where there are two girls dressed gothically and they have a pit bull for a service dog and a studded chain matching their own clothing shows that there's something more going on here. That we're at the point where we're not recognizing perhaps this isn't the best and most safe environment to have this kind of dog. Perhaps I should consider a different type of dog for my service animal if I'm going to be taking it into confined, tight spaces where children and other people will be. And, you know, I just keep coming back to this idea as people of faith, we are challenged, very challenged, I think, to have a perspective that considers others. I think that this is kind of my point at the end of the day. Sometimes we miss the mark when we focus on the mental health crisis culture and how, well, I'm struggling with mental health. And we go around telling people, well, I struggle with mental health, or I struggle with a particular autoimmune disease, or I struggle with this. And we forget common courtesy to see others and not just turn in on ourselves. Now, there's that balance, I think, between understanding the need to care for ourselves and meet our needs, but also at the same time recognizing that there are other people around us in our environment, that we don't just live in isolation. Yes, we have the great gift of freedom, but freedom is for the purpose of doing good, not just isolating ourselves and not doing what is right. You're listening to Trending with Timmerie here on Relevant Radio. I want to dive into the topic of ADHD. With COVID, cases of ADHD have actually been on the rise among young children, as well as significantly with teenagers. In fact, with teenagers in particular, we've seen an ongoing rise over the last 15 years. It used to be that ADHD was predominantly only diagnosed for kids right around the ages between 7 and 12. Now, all of a sudden, we're seeing kids as young as 5 diagnosed with ADHD, and kids going well into their teenage years diagnosed with ADHD. It's sort of a fascinating phenomena, and there's so much that could be said about it, but I hope to kind of provide a different perspective and more solutions on this. I've been diving into a lot of the content surrounding the ADHD crisis that we're seeing. You and I know, especially if you have children, there's been this increase in kids being at home, online learning, at-home learning, an uptick in digital use from technology to social media to text messaging. And we're also seeing that for years now, that ADHD in particular has been a struggle for young boys. Young boys where we've seen trends across the nation with things such as the outrageous, I really do believe outrageous, zero tolerance policies. Psychologist Michael Thompson has commented that today in the school systems, girls' behavior is idolized as the gold standard. And boys are basically considered defective girls, because they don't behave and sit still for long periods of time the same way girls behave and sit still for long periods of time. Boys make sound effects that little girls don't make, that, by the way, can be really annoying. I was just reminded of this the other day. I come from a family of 3 girls and 1 boy. And when my brother was the third to be born, years later, I remember he would make all of these loud noises with his mouth and the spitting, psh, psh, explosions, sword fights. And as I'd hear this, I remember complaining to him, I'm like, can you just make him be quiet? He won't sit still. He's so annoying. There was nothing wrong with him. He was just being a boy, and it took us girls some getting used to recognize that, even for my mom. The difference of getting used to having a boy. We were talking about how the neighbor kid used to make annoying grunting sounds all the time outside. My mom would kind of shout out the house like, hey, be quiet, like, why are you making those sounds? And then lo and behold, she has a son, and boys make different sounds. They're different from girls. There's so many differences. Even my brother, everything growing up, he could turn into a sword, or usually a sword, not so much a gun, but a sword in particular. The best was when my older male cousins would come over to the house and he would decide he'd want a sword fight, but his sword was a pencil and the other person was expected to sword fight with their finger. That one worked out really well. But you see, with this zero tolerance policy that's been occurring across the nation, there's been this growing problem that boys are expected to behave like the golden standard of girls, ignoring the differences between male and female, ignoring the differences in interests in learning, ignoring the differences in capacity to sit down, need to move. So many different things. We've heard countless stories about kids getting in trouble for eating a sandwich and turning it into the shape of a gun. Or stories about little boys getting in trouble because they were told to draw a picture of something that mattered to them, and they drew a sword fight between pirates and other guys, and they showed images of some heads being chopped off and some swords. So all of a sudden, there's something wrong with little boys because they're portraying violence. And they must not be okay in the head, according to many of our education systems today. And so the challenge today is we're seeing these diagnoses of boys where I know my peers going into college, coming out of college, to grad school, and now in my adult life, seeing so many of them who had been on various forms of Adderall to other medications, Ritalin for ADHD, and they were told for so long that something was wrong with them. No one talked to them about diet, getting enough exercise and movement for that particular little boy. No one talked to them about maybe there was a different book that was more interesting for them to read than some of the books that were being presented to them. And there's so many elements. They were being told that their imagination wasn't okay because they portrayed some levels of violence. And they've suffered from zero tolerance policies, that is, outright suspensions over and over again. But let's be real, even my 20-something-year-old brother still likes to play little pranks. In fact, he's liking to prank now my almost 1-year-old baby. Some things are just different between boys and girls. That doesn't mean they deserve a zero tolerance policy. That doesn't mean they deserve to be told something's wrong with them or be put on ADHD medication. Adderall, Ritalin, when a little bit of a change in their diet, more movement, among other things, could change. I remember a study came out of Finland some years ago, because if you don't know this, the schools in Finland have some of the best school systems and highest scoring in terms of education in the world. And so some people went to Finland to study and model what the Finnish people are doing. And what they saw is in Finland, they do something that really helps to mediate a lot of the ADHD crisis and increase grades. And that is, for every 45 minutes of studying and sitting done, kids would get a 15-minute break of unstructured play. That is, their activity wasn't planned. They could do what they wanted. What they saw was an increase in focus, attention, social skills, academic skills. It was a huge game changer, and this is what the Finnish people were doing that was different from, for example, us in the United States. In fact, kids are often being limited to recesses of only 20 minutes for the whole day. And it was fascinating. I remember seeing a study out of Texas back in 2017 that showed that they were beating ADHD. They were trying to help kids not have to go on any type of medication and trying to help work with them in the environment. And guess what? They were beating it. They were seeing a major change. What they did, some schools in Texas started giving 4 recesses a day, each 15 minutes long. Some people might argue, hey, you're cutting into their education. But in reality, when they came back in from this unstructured play, they were better able to cope with sitting down, paying attention, focusing. They were getting better scores in what they did. You see, I think that a lot of what we're seeing right now is a anti-boy learning environment, even if that's not the intention. We're comparing the capacity to sit still and be a little bit more mature at a younger age of girls with boys who are more rambunctious, talk about different things, are interested in different things. There was a great PragerU video that came out a few years back titled War on Our Boys, and it talked about a handful of solutions. One of them talked about helping boys to be good readers by appealing to things that boys are actually interested in reading, rather than forcing certain types of books on them. For example, nonfiction. They love various types of nonfiction, world records, comics. They love comics. Sure, it might be different, but they're actually learning good things and stories that can inspire them to other types of stories. Guysread.com is one resource to help find things for your son, or maybe yourself if you're an adult and you thought you never liked reading, but were forced to read things you didn't like. You might suddenly discover that you really do enjoy reading. In fact, my husband's really started to enjoy and rediscover reading in marriage. And it's because we talked about types of stories that he would actually enjoy rather than being forced to read a type of thing. He figured, wow, I actually am interested in reading. We have to do away with zero tolerance policies and recognize that boys can't meet the same standard in terms of perfect stillness and conversation the exact same way that girls do. And again, we have to bring recess back. Those were some of the solutions brought up by one of the researchers at PragerU when talking about this crisis surrounding this almost anti-boy culture. But here's what's fascinating. I want to touch on this before we come to Dr. Susan Caldwell in just a little bit here on Trending. She's going to be talking about postpartum depression, some great solutions helping to identify it, and we'll also talk about some of the benefits of progesterone for various stages in women's lives. So before we go there, as we're seeing this uptick in reports from pediatricians, parents, of this rise in cases of ADHD, not just among young boys, but among teenagers as well, it shouldn't be surprising. Here's the reality, and I think this is really fascinating for us to ponder for just a moment. Dr. Leonard Sachs, who's written a number of books, by the way, on differences between boys and girls, behavior, fascinating work. He talks about how a lot of these ADHD diagnoses are not actually ADHD themselves. That actually what we're seeing is studies have been done, especially coming out of Stanford University, Dr. Dements, who talked about how sleep deprivation actually mimics ADHD. I'm going to give you a really simple example of this. We actually saw this back in the 1980s, and we see this to this day occurring in places such as Silicon Valley, where culture can be very stay up late, party, do whatever you want, but then go to work the next day and yes, work hard. But if you're going to maintain a certain type of all-night lifestyle, well, you need something to make it happen. That would be cocaine. Now, here's the reality. Adderall is a heck of a lot cheaper than cocaine, and it's covered by insurance. But here's the deal. This is what's fascinating. If you actually look at it and really understand, we see Adderall, Ritalin, and some of the others. Well, basically Adderall speed. It's an amphetamine, and that's really important that we understand, because both Adderall, Ritalin, and some of the other treatments for ADHD, they bind to dopamine receptors in the brain just like cocaine. So back in the 80s, people discovered if they wanted to party all night and then work hard during the day and have great focus, attentiveness, well, just do some cocaine. But you see, high schoolers and college-age students are suddenly being diagnosed with ADHD. But what's happening? They're not necessarily partying and going out, though that could be a thing. What they're suffering from is sleep deprivation. We've talked a lot about this with Lieutenant Colonel Dave Grossman here on Trending. And I think what Dr. Dements at Stanford University keeps pointing at is that sleep deprivation and its mimicking of ADHD type of symptoms, such as concentration and attention issues, shows this fact that all of a sudden we're seeing this increase in high schoolers having ADHD, and even more so during COVID. Well, what we're seeing is that during COVID, we've also seen an increase in kids using more technology. We see this via text messaging. We see this via social media, from TikTok to YouTube to Instagram, you name it. By the way, that's a baby. She's totally teething in the background right now, if you can hear her. So from all of these things that are happening, kids are staying up late on their phones. Most homes, parents are leaving, well-intended or maybe not thinking about it, kids unattended with cell phones, up late on their phone. Who knows how many hours these kids are actually getting in sleep. And so all of a sudden being prescribed Adderall or Ritalin to help them in studying and being attentive is to compensate for sleeplessness. Similar symptoms perhaps to ADHD, but not the actual problem. So real solutions would include adequate sleep, removing screens from the room. Again, we talked about this with Melanie from ScreenStrong.com. Check out the solutions. Maybe no technology at all for your kids until they're much older, into their teen years. Decreasing social media use and more time outdoors without the iPad or whatever it might be. It might help with this ADHD crisis that we're seeing among boys and teenagers now. Today's programming brought to you by St. Gregory Recovery Center in Iowa. More information about their faith-centered addiction treatment is available at relevantradio.com/stgregory.
Bridging your Catholic faith with your everyday life. You're listening to Trending with Timmerie on Relevant Radio and the Relevant Radio app.
Ooh, postpartum depression, it is a growing topic, often not addressed or discovered way too late. So joining me to discuss it today is Dr. Susan Caldwell. She's a medical doctor who specializes in NaPro technology, which helps people struggling with fertility, infertility, and overall women's health, treating underlying health conditions, not just prescribing birth control as a Band-Aid or telling women to just get over themselves when it comes to postpartum depression, but actually looking to what's actually going on. Few are trained in this, and Dr. Caldwell is one of them. Dr. Caldwell, welcome back to Trending.
Hi, Timmerie. Great to be back.
It's great to talk to you. It's fascinating as we look at postpartum depression, because for some it can be as simple as new adjustment to a new baby, first baby, lack of sleep. It was simple little things that, yes, can be tweaked, getting back into exercising, finding a sense of self-control with your newfound diet when you suddenly crave all these carbs, and that can be impacting your emotional and mental health. I mean, there's so much from hangriness. It's not necessarily actual postpartum depression. And so I want to unpack a little bit of some of the signs of true postpartum depression, if you could tell us what those are and some real solutions.
Yes. So we have a protocol developed by Dr. Thomas Hilgers at the Pope Paul VI Institute. And what we do is when a woman comes to our attention who feels like she might have symptoms that need to be treated, we have a worksheet that we go through with the woman, and we ask her, these questions. I'm just going to mention the symptoms that she can have, and these are the symptoms that we really are focusing on. And quickly, their depression, anxiety, what she would call that. We don't really get too technical on what that means. We just ask her those questions. Any panic attacks, fatigue that's out of the ordinary, insomnia, poor appetite, a feeling of helplessness, a feeling of being wired, shaky, crying, hot flashes and night sweats, rapid heartbeat, nausea, strange thoughts, suicidal thoughts, and then anything else that the woman might want to explain. But those are the symptoms that we're really focused in on. Yeah.
Now,
And then,
let's say
yeah, go ahead.
I'm just going to jump in here for a second. So a lot of these, some of which could kind of cross right over, we're just having a baby. Some of them even like hot flashes, night sweats, kind of just unique thoughts as you're first getting used to a baby and you're afraid of different things that could happen to your baby. And you're like, why would I even think that could happen to my child? I don't want to do that, but that could. Where's the line of kind of overly assuming that you could have postpartum depression or did, and actually like checking off the boxes?
Right. Well, that really, it's good for the practitioner, in my case, the doctor, to really know the woman. So ideally, this would be a patient of mine who I knew before she delivered. And so taking a good history, because it's hard to know someone's temperament and things like that. But these are symptoms that really interfere with her ability to be present to her child. There's a lot of a lot of women who I've spoken to, there's a lot of fear about what would happen to the baby. The baby could die. I mean, it's a lot of irrational thoughts going on. And so it's important to take a good history. And I'll be honest, there have been some patients who I wasn't sure what was really going on, and didn't fit the criteria exactly. But the treatment is progesterone. And it's so easy to give that I don't really worry so much about, I'm not going to hurt her by giving her treating. So if I over-treat her, it's not going to hurt her at all. In other words, if I just err on the side of over-treatment, it would not at all harm her. So I don't worry so much about, making the diagnosis 100%. But I think there is a role for, asking the woman and really considering, maybe is her partner, what are the social circumstances? Is her husband really, does she have enough support? Sometimes I see this in women who didn't have postpartum depression in their first or second pregnancy, but in the third or fourth, there's a lot of anxiety, but she's also trying to get, the son to the soccer game, and she's trying to, do all the supermom stuff that she's always done. So, we always want to take into account all of the circumstances that are happening inside of her experience, but also what's her support system, and could there be, could the situation get improved by just some help so that she can rest and can eat well and things like that.
So is it that a woman actually has an inadequate amount of progesterone, low progesterone, and that's why the progesterone is being used usually? Or is it because progesterone just helps this?
Yeah, so we are very well aware in pregnancy, if you look at the graph of the progesterone levels throughout pregnancy, they start, levels, in the first month of pregnancy, we want her levels to be around 25. Well, when she delivers, levels are around 200. I know that doesn't, really, it's a lot more.
It's higher, right?
And then the day after she delivers, when that placenta is gone, her progesterone level is 0. And progesterone is extremely important for the brain to feel calm. And it's been called nature's Xanax. So it has sedative properties in the brain. And a woman has come to enjoy, in pregnancy, you come to enjoy that progesterone because you just, some people don't enjoy being tired and feeling a little sluggish maybe, but there is a sense of calm that it provides. So when you abruptly take that away, in some women, the brain does not react well, and so the research that Dr. Hilgers did, there was a dramatic improvement in symptoms. I mean, really, we're going like, we're down, I don't know, like eight, like 80% of women who have significant, their symptoms are gone when they get progesterone. I mean, this is really astounding when you see it. It's quite impressive.
Fascinating. You're listening to Trending with Timmerie with Dr. Susan Caldwell here joining us on Relevant Radio. She is a medical doctor specializing in NaPro technology, helping people struggling with fertility, infertility, underlying women's health concerns, especially looking at everything from PCOS to endometriosis. And we're talking about postpartum depression and how simple progesterone can help in alleviating postpartum depression. As I'm looking at this, Dr. Caldwell, and by the way, if you have a question, the number is 1-888-914-9149, or you can ask now on my Instagram story. Follow me at Timmerie. That's Timmerie. I would be happy to take your question live now. Please just go ahead and ask. We'd love to help you. And it doesn't have to be related to postpartum depression, anything fertility, women's health related. But as I'm hearing what you're sharing, Dr. Caldwell, kind of just even thinking in my own experience, I just had my first baby this year. She's, by the way, going to be 1 year old next week. I can't get over this. But so I had the baby, was doing great. And then big news, a lot of my listeners know the shock. My husband landed a really great job and we moved cross country. And that was really, really, really hard on me. And as I'm looking at some of the list of postpartum depression signs, I would say I had a lot of them, but it wasn't until after the shock of a move. So for people who maybe are doing great after having their baby, but then something in life happens that throws them, could that be part of postpartum depression, or is that more situational?
Well, again, this is the thing. The more I try to clump women into groups and control and label and all that, everything gets blown out of the water. I mean, so we can talk in generalities because, here you were, right, with this baby. As a mom, your nesting instinct is so important. It's so amazing that, you want everything to be in order. You want to have a routine, and then everything is thrown out of the window. And so that's, I would say that's multifactorial. I mean, if I were treating you, I would really ask about, in the first month, how were your symptoms? And I would ask, like, did you have any of those symptoms in the first month versus how you were having them now? And we would talk about it. And the other thing is, it depends on when your cycles came back. Because if and maybe your cycles hadn't returned, but when a woman's cycles return naturally, she's then ovulating and making her natural progesterone. So, and that really depends. So if a woman is breastfeeding exclusively, she may not have cycles return, until 9 months or a year. So, so for example, if you had told me, oh yeah, my cycles were back. So if I knew you were already getting progesterone, then I would be less inclined to think it was related to low progesterone. Does that make sense?
Yes, that does make sense. So second question, kind of following up on that, because I know a lot of women today working with NaPro doctors are going through their pregnancies because they are struggling with PCOS and other issues that are influencing low progesterone during the pregnancy itself. So let's say a woman ends up on progesterone to support her through the pregnancy to help keep her from miscarrying, help keep the baby intact from early delivery. What if you then have had all this additional artificial, I guess you could say, progesterone support, you go off of it, and then afterward, should there be follow-ups done for these women who are on progesterone to see if they're more at risk for postpartum depression?
It's so interesting. Dr. Hilgers, in his book, the medical textbook that we learn from, he says in his practice, he rarely sees postpartum depression, like over the decades that he's been practicing, compared to other. So he thinks that if your progesterone is well managed, let me say this. So there is evidence that women who naturally have very high progesterone levels in pregnancy have a higher risk for postpartum depression. Okay. But women who are monitored throughout pregnancy with progesterone, usually those women do not have very high levels. We are doing everything we can to keep their levels just at the average, average range. We never give these high levels of progesterone in any patient who's pregnant. We just try to keep their levels just adequate, right? And so that's
So it's
so
not this
interesting because
oversurplus.
to be honest, I rarely see to be honest, I don't. The women who I see with postpartum depression are all most of the time women who didn't need progesterone in pregnancy.
Interesting. Okay, so
It's
they
so
want people who struggle
fascinating.
with lower progesterone.
Right.
Fascinating. Yeah, okay, so these are great solutions, helping to identify some of the signs for postpartum depression and to really be working. This is, I think, shows why it's so important to work specifically with a NaPro doctor who specializes in specifically NaPro technology that is treating postpartum depression, not with medication that many people are finding themselves dependent on for far longer that had side effects, but natural progesterone, compounding progesterone that makes a world of difference in women's bodies. I think this is incredible because I've had friends, Dr. Caldwell, who were seriously struggling with postpartum depression. And it wasn't just a matter of exercising and sleeping right. Their progesterone levels were off. They were really struggling. And taking that first shot after giving birth and after kind of pinpointing the postpartum depression and getting the progesterone made a world of difference, like day and night difference within a day. And so I love that this is such a fantastic solution, but too few people know about it. So what would be your go-to if someone's never worked with a NaPro doctor before to start working with one to identify postpartum depression? Where would they go?
Wow. I mean, so just to know, for everyone to know, you don't have to be charting. You don't have to have been charting before the pregnancy. So there's no club, where you have to have a ticket, and be charting. So yeah, so you just want to reach out you can call you can call the Pope Paul VI Institute and they will find you a doctor. Or I know you often give them a link to medical consultants all over the country. There's mycatholicdoctor.com. They do televisits all over. So it's really, and you don't have to be seen in person. It can be done. Now, the trick is, as you mentioned, there is a shot of progesterone that is part of the protocol. So sometimes that can be tricky, just finding someone to give the shot. It doesn't absolutely have to be a shot, but it's best. So
Excellent.
that's the trick.
We'll post a link on social media to the list of NaPro doctors as well as online practitioners as well for NaPro. And it's so helpful to have this to send it to someone you know. And as you said, a lot of people are practicing telemedicine before. So if you don't have a NaPro doctor in your area, you can work with one digitally. It's such a gift, especially when NaPro doctors are in high demand, but there are a few of them across the country, but they are out there. So again, we'll post links to that in social media as well as in the podcast notes for today's show. If you have a question, we'd love to take it. The number's 1-888-914-9149. We have a call coming in from Kathy in Orange, California. Kathy, what's your question related to progesterone today?
Hi, I am not, I haven't had a baby, but I did. I am postmenopausal, and I had breast cancer. They determined that it was progesterone positive, and so I can't take progesterone. I've had several friends who've recommended that I use creams and that sort of thing, but my doctor recommended that I can't use anything that acts like progesterone. Mm-hmm. And I'm wondering if that's some of my issues that I've noticed over the years, that I get what I feel like are depressed or depressive bouts. And it might be every couple of years. It might be, but I'm wondering if it's related to that and if there's something I can do, and would a NaPro doctor help me?
Wow. Okay, so you said you are postmenopausal. Is that correct?
I became menopausal with the breast cancer treatment.
Okay. So NaPro really focuses on the reproductive years of a woman. So I would say just off the bat, NaPro is not really directed at women who are no longer having cycles. So I would say that's probably not going to be helpful. If I were you, I would stick to your oncologist, and you can find there are a number of doctors out there that are really working closely, functional medicine doctors who are working with breast cancer patients. There's a Dr. Lindsay Berkson who has a radio show. She's a breast cancer survivor. She's a hormone expert. I would consider you can if I were you, I would look for someone like that to work with who really knows their stuff around hormones and breast cancer. That's really, really important. Again, her name is Lindsay Berkson, and she has a podcast. And I think she works out of Florida, and she does telemedicine. But I think you're more geared. That your situation would be more geared to someone who maybe is not necessarily a NaPro doctor, because we don't learn protocols for women who are no longer having periods. But in the question, I really don't know whether or not what was going on in the history. We don't know because most doctors, hormones are not well understood by most doctors, and much less hormones as they relate to breast cancer. So, I would reach out to somebody who really specializes in that. And there are those doctors out there.
Fantastic. And just kind of quick question of clarification, because I know we've talked about people who are in their menopausal years and working with a NaPro doctor to check hormone levels. Dr. Caldwell, how is that not related to the reproductive side, and who would be someone who would look for that help?
Sure. So remember that when a woman is in menopause, she is no longer cycling. So her levels, her hormone levels are naturally or essentially zero. So I see lots of postmenopausal women, but in those women, I am treating simply blind based on symptoms. So I'll treat with estrogen or progesterone at the lowest dose to treat certain symptoms. But the NaPro protocols are specifically targeted towards women who are cycling, and we give cooperative treatment to normalize the hormones. So in menopause, we don't have normal hormones anymore because we're not cycling. So at that point, it's a totally different type of treatment, and that's just supplementation of hormones without necessarily testing and treatment.
Got it. So you can supplement as NaPro doctors, but it's kind of different area, different ball game, and so certain areas don't fall. And that makes sense. So we're going to come back with Dr. Susan Caldwell. We're going to talk about other phases in life where progesterone can be extremely helpful for women, and we'll take your questions related to women's health and fertility. You're listening to Trending with Timmerie. I'll be right back with Dr. Susan Caldwell.
Bridging your Catholic faith with your everyday life. You're listening to Trending with Timmerie on Relevant Radio and the Relevant Radio app.
Dr. Susan Caldwell joins me today on Trending, and we're talking about everything from postpartum depression, which we were just discussing, taking your questions regarding fertility, women's health. We want to talk about more of the benefits of progesterone during different phases in a woman's life. But if you have a question, number's 1-888-914-9149. You can also ask now on Instagram. We have a question coming from Marisa in Sacramento. What's your question about endometriosis, Marisa?
Hi, I have endometriosis, and I've had it since my teen years. It runs in my family, and the only thing that the doctors really recommend is birth control, and I've stopped taking birth control since a little bit before I got married, and I just wanted to know if there's any other alternatives that you would suggest to help with ovarian cysts, because I've also had ovarian cysts and a laparoscopic surgery. As well as now 2 pregnancies, which the doctors didn't think I could have children.
Oh, that's great.
Praise
That's
God.
great. That's awesome.
And I'm going to say, what great news for those people who are told who have endometriosis that they can't have kids. Your story is a testament to the truth of that. So any solutions for something other than birth control, Dr. Caldwell?
Yes. So it would be great if you were able to chart your cycle with a Creighton practitioner, because hormone problems tend to bring their friends along. In other words, you don't tend to have just one problem like endometriosis. Just like you said, you also have cysts. And are those cysts endometriomas? I mean, in other words, we need to kind of figure out we've got to figure out the big picture. what's going on. I mean, you could also have a thyroid issue. You could also have PCOS going on. So you want to make sure that you have the proper diagnosis. Endometriosis is a diagnosis, and it is a big one. And it is typically treated by surgery. So going to a doctor who knows what they're doing. They are fellowship trained. That means they have gone beyond their OBGYN residency. They're not just a general OBGYN, but they have had intensive, at least 2 years of specializing in just endometriosis, because that disease can really fool a lot of doctors. And you have to have a doctor who is willing to be and courageous enough to treat endometriosis no matter where it goes. For example, I have several patients, 2 in particular I'm thinking of, who had very significant bowel involvement, where the doctor went in and saw that the colon was infiltrated with endometriosis, and these 2 women had to have their colon totally fixed by a colon surgeon at the same time as the endometriosis was taken away, was excised. So if you just have a doctor who's just a run-of-the-mill OBGYN and they see that colon involvement, they are just going to be afraid to touch you, and they're just going to close you up and walk away and say, oh, we couldn't get it. I didn't know how to get it. So it's super important that we just know the whole picture, that you're charting, you know all of the things that you're dealing with, because when you have endometriosis, you're not well. And I frequently see women who have endometriosis also have Hashimoto's. And, then we tell you, make sure you're eating an anti-inflammatory diet that can help the endometriosis symptoms. So you just deserve a really good workup. And it seems like the NaPro doctors tend to really know how to do that well. So I would start there.
And if you need a NaPro surgeon as well, I know, Marisa, I see that you're in Sacramento. I'm sure they're probably more closer to you, but I know Dr. Teresa Stegan is in Southern California, and she is a NaPro surgeon as well as NaPro doctor, because sometimes finding those who can help, give the referrals and find the information, do the digging. I know someone right now who's getting ready to have an exploratory surgery done where they're going in to remove some things, but they're also looking for endometriosis and other signs and removing what they need to in the process. So many pieces of help and information and true resources. And Dr. Caldwell, I know we wanted to dive into the topic of progesterone, but if you could just speak briefly as we're talking about all these diagnoses from PCOS, endometriosis, postpartum depression, where does food play into all of this and how can it help?
Yeah. So I love there's some great functional medicine podcast. So functional medicine is a great kind of way of looking at our health, and it kind of looks at food as medicine or food as poison. And unfortunately, we live in a culture that just invites us to eat a lot of things that are toxic. And there's a lot of history in how our food became so toxic with pesticides and so many, the shifting in our foods, so many carbs,
Hormones,
processed
dairy,
foods, hormones.
yeah.
Yes. And so anything, so I just recommend that anybody with, reproductive issues just really learn more about food. I would recommend Dr. Mark Hyman's podcast, The Doctor's Farmacy. He's got a lot of great information. There's a lot of great Instagram accounts, people, nutrition, PCOS dietitians, and things like that. So, just to get informed about the condition that a woman has, to know what she has, and then, what does it look like to be healthy with, and eat well. There's so many facets that and there's so much information we have now. So I would just recommend that people just look at that and consider changing their diet. Yeah.
It's such a different mindset. That's why I wanted to talk about it briefly, because I know for me, my journey with all of this, going eventually into NaPro technology, was I had food sensitivities, severe food allergies. At one point, I had over 30 food allergies, and we figured out that all of these foods, when I was eating them, was triggering polycystic ovarian syndrome as well as Hashimoto's disease. And, all of this led to finally figuring out, okay, we've got to cut a lot out of the diet. It's hard. It's challenging. It's moments where you feel so isolated in terms of what you can and can't eat. But I think that with how much, like you said, our food has been modified, it's important to see some of these solutions and the crossover surrounding fertility, endometriosis, and a lot of the struggles people are having today. So Dr. Susan Caldwell, drsusancaldwell.com. I'll post a link now on social media as well as in the podcast notes. Join me Monday.